Hello, my name is Adam Smith-Connor. I'm a chartered physiotherapist at New Forest Physiotherapy Clinic, Kingfisher Way here in Marchwood. And I just want to talk to you today about arthritis in the knee joint and total knee replacement surgery. So the knee joint is a hinge joint. It's made up of the patellofemoral joint, that's the back of the kneecap here, and the femur here. The kneecap sits in this groove and moves up and down inside of that groove. That's one part of the knee. And then the knee joint itself, which is between the femur at the top and the tibia here at the bottom, and that forms a joint. The top of the tibia here with meniscus, and the femur here that articulates with the meniscus and the tibial plateau. That's the top of the tibia. Now, the surface of the femur is covered, and the back surface of the tibia is covered with what's called hyaline cartilage. Now, hyaline cartilage should look like smooth marble. If you ever eat a chicken bone and you look at the joint of the chicken bone, you'll see like a thick, rubbery material on that joint. That's cartilage, hyaline cartilage. Now, chickens are slaughtered very young. They're only a few weeks old when they're slaughtered. So their hyaline cartilage is in pretty good condition. But as we get older, that hyaline cartilage thins and degrades, and it gets thinner and thinner over time. The property of the hyaline cartilage is that it's hydrophobic, so it repels water, a bit like a non-stick frying pan repels the fat. The hyaline cartilage does the same thing. Now, what that means is that the surface of the joints don't actually touch, because it's repelling fluid, and then that, rather than the surfaces touching like this, there's actually a gap between them which is filled with synovial fluid. But over time, what happens is that surface, that hyaline cartilage, starts to break down, and the fluid, the synovial fluid, starts to be absorbed into the hyaline cartilage. So its repellent properties degrades, and the joints start to, the cartilage gets thinner, and the joints and the bones start to get closer and closer. Eventually, once you get all the way through that hyaline cartilage, you get bone on bone, and that is effectively what arthritis is. It's bone on bone when all the hyaline cartilage is gone. Now, hyaline cartilage doesn't have pain nerves in it, whereas bone does. So once you start to get bone on bone, it starts to rub, and you start to get pain, basically. When you look at an X-ray of the knee, X-rays don't show hyaline cartilage. So what you would see is a gap between the femur at the top and the tibia at the bottom in a healthy joint. And in that gap, you've got the hyaline cartilage, and you've also got the meniscus, which is another form of cartilage. When they break down, the joint space reduces, and eventually you get a kissing joint. In other words, it's touching on the X-ray, and that's arthritis. As the pain progresses, you may get to a point where you need a total knee replacement, or possibly a half knee replacement. Now, I've got the upper part here. This is only the upper part of the femoral part of a knee replacement. So what happens here is the surgeons, they cut off the end of the femur and then place this metal over the top. They do the same on the femur. They cut off the top of the femur here, they slice that off, and then they'll put a metal plate on the top of the femur, the tibia. They remove the tibial plateau, put a metal plate there, and then on top of that metal plate there'll be a high density plastic, so you don't have metal on metal, and that's a total knee replacement. That's quite a hefty lump there. By removing the bone, they're removing the source of pain. However, knee replacements do require you to do a lot of work afterwards, and actually some work beforehand. So the muscles and the soft tissue around the bone can be worked on to improve their condition. Once the hyaline cartilage starts to go and the bone starts to go, unfortunately at the moment we don't have the technology to regrow hyaline cartilage or the bone. Well, we have a limited technology to do it, but it's very limited over small areas. I don't want to go into that now. But basically, once it's gone, it's gone. However, the muscles and the ligaments around that joint, we can work on those. So you can do exercises, which things like sitting, standing, step up, squats, those kinds of things to build up the muscles around the joint, stretches to bend the knee up and stretch the hamstrings. What those will do is build up the strength of the ligaments, the tendons, and the muscles around the joint, the soft tissue support around the joint. And by improving the soft tissue support around the joint, increasing its stability as best you can using those structures, there'll be less stress on the joint surface, and therefore you're going to feel less pain. Now, I do run a class which is designed to do that, and you need to do these exercises either pre-op to improve the stability of the joint, or post-op after your knee replacement to restore that stability afterwards. Either way, you need to be doing these exercises if you've got an arthritic knee. So I do a class at Marchwood Village Hall. It's on a Friday at 9:30. I do need to assess people before they come, but the class itself, it costs £10. It lasts for an hour, and it's a group session where we build up the knee strength and stability. If you would like to come to that, please give us a call. And if you'd like to find out more about the hip and knee class, you can either pop in on a Friday at 10:30 and just watch the class, or give us a call. My number's 023 8008 9120. Hope to see you at the class or at the seminar. Thank you.